My name is Guy, and my dream career is a homicide detective for the Maine State Police. In this scenario, a homicide detective is sitting in his office doing research on one of the 7 active cases he has. Being one of the 5 active homicide detectives in the state, he has a lot pile up throughout a year. He gets a call that there has been a homicide in Augusta, Maine, and the initial investigation has been completed. The officer The scene is gruesome, and he has to look at the eyes of the family as he investigates them, interviews them. The pain is painted on their face. This investigation could last anywhere from 2 months to 20 years. He will work his heart out to get a conviction for this family. My psychological subfield is clinical psychology. Clinical psychology is the study and potential treatment of mental and behavioral disorders. An example, depression, PTSD, and many others. Things that instill your emotions into trauma. In a lot of mental and behavioral disorders, they start with adverse childhood experiences, or ACEs. Things like being in the military, law enforcement, abusive relationships, etc., they all can affect our mind in both negative and positive cognitions. My psychological concept is depression. Symptoms and characteristics of depression are as follows: negative mood, not wanting to participate in activities, loss of interest, loss of pleasure, loss of will to live, loss of love, more sensitive to emotion, trouble sleeping, trouble eating, sadness, suicidal thoughts, and many others. Kinds of recommended treatment. The most common types of recommended treatment for depression is therapy and medically prescribed antidepressants. Why is treatment important? Treatment is important because in order to be an effective human being, you have to find pleasure in your life. Most of the time we live for something, and when we no longer get joy out of those things, that's when people take their own lives. Nothing is more valuable than a human life, and that's why treatment is so important. Treatment or intervention. The treatment I have chosen is therapy, as it is one of the most common types of treatment, especially in law enforcement. Find the treatment or intervention. Therapy is a form of counsel to help with clinical psychology. You sit down in a private and safe environment with a licensed therapist. They attempt to find the root of your problems and help you work through them. Therapy is becoming more and more common, especially in police work. Law enforcement has one of the leading suicide rates in all jobs because of what they have to deal with. So some police agencies around Maine and all over the world actually require their officers to go to therapy. They sometimes have a therapist come in and speak with all of the officers as well in a board meeting. The stress they go through on their family and work can make them break, leading to a major depressive disorder diagnosis. So through therapy and being able to work through their pain can help tremendously. Not every case is a success story, so that's why it's so important for these officers to get help. To finish the scenario, that officer from the scenario is struggling. The trauma he saw in that family eyes has scarred him. He struggles to get up in the morning in the question of if he has any value in this world, questioning if he wants to live in a world where that trauma can happen to a family. He goes to his supervisor to talk about his poor thoughts. His supervisor tells him he will be placed on leave until he goes to therapy, a common practice in law enforcement. He talks his feelings out with the therapist and is later diagnosed with major depressive disorder. His police chief says he will stay on the force if he agrees to go to therapy for 2 years. He agrees. While the trauma he experienced will never fully go away, and neither will the depression, his therapist will work with him to help overcome this pain he has experienced. After about 3 months, he rejoins the active workforce as his therapist has helped him overcome his suicidal thoughts. He will continue therapy for those 2 years, but again, he will never truly be free from that trauma and experience.